Hello, good evening, everyone. We'll wait for another 5 minutes for everyone to join and we'll start at 5:05. Thank you. Good evening, everyone. Thank you for joining us today for this webinar series by Daily Bloom Dr. Reddy's. Today, we'll be discussing about IBS food myths. My name is Simran, and I'm a nutritionist at Dr. Reddy's. And so far, I've taken over 1,000 consultations for IBS and other gut-related conditions. So I welcome everyone. Okay, so I think we'll get going then. We'll get started. I think almost 20 participants have joined. Uh, so yes, hi, good evening everyone. So today we'll be discussing about mostly IBS food myths and we'll be covering major three aspects of IBS. The very first one is IBS a disease or not? The second one is the general triggers and food triggers. In addition to that, at last, we'll discuss the holistic management of IBS. And if you have doubts at any point, please raise your hand, or you can put your question in the chat box option and we'll be taking them in between or at the end of the session as well. So let's get started. Yes. So here's a quick question for you, all of you. And here it is. Is an apple safe to eat for someone with IBS? The options are yes, no, I don't know. Uh, so we'll find it out this later. And thanks, Shelly, for your answer. Stay tuned to learn more whether we can have it or we cannot have it in IBS. Moving further. So is IBS actually a disease? What do you guys think? You can write your answers in the chat box. Okay. Moving further, yes, Kaushik has rightly mentioned, IBS is not a disease. Actually, IBS is considered as a disorder, meaning there's a difference between when I talk about disease and a disorder. A disease has a clear identifiable cause, and it is generally caused by, it has a root cause. Whereas when I talk about disorder, it does not have a clear identifiable cause. And disorder is generally your cluster of unpleasant symptoms. In IBS, these are mostly your digestive symptoms which are happening. Now, when I talk about disease, there can be the structural changes, but in disorder, there are no as such structural changes happening in your body. Simple example I'll just use here. There is another gut health condition called as ulcers in your colon. Now, ulcers in your colon is actually a disease condition, or you can talk about something as typhoid. So, typhoid is actually caused by when you drink unhygienic water or say eat any food. So, you get a typhoid infection. So, that's basically a disease caused by your bacteria. But when I talk about something as IBS, so here we do not have clear identifiable cause, so that's why it is a disorder. And usually, disorder cannot be cured, but they can be managed by identifying your trigger points and through lifestyle modification. Moving further, so that's a very interesting. The major problem with IBS is the majority of the patients are not diagnosed, and in fact, one of the studies says that 75% of patients with IBS lack a formal medical diagnosis, meaning they might be having IBS, but they're not even aware about it, given the lack of awareness. So moving further, the major IBS symptoms are very first and common one being prolonged constipation, prolonged diarrhea, bloating, the abdominal distension, and abdominal pain, which is usually seen in the left side of your digestive system, and it's usually centered around your navel area. And the fifth one is chronic stress. Now, you might be thinking how stress is related to IBS, but then a lot of studies has shown that, and a great quality research work has been done, how stress can cause IBS or how stress can worsen IBS. This is actually called a trigger cycle of IBS, meaning a very simple example I can quote here is your brain and gut are directly connected. You can consider them as your best friends. So if gut is not doing great, your brain get upset. If your brain is not doing well, your gut gets upset. So it's actually called a two-way communication. Now there are a lot of other functions which your gut does beyond digestion of food. One such function is uh, production of hormones. Hormones are simple neurochemicals which affects the way you feel, or which affects the way you eat food, which affects the way you feel on a day-to-day basis. Now, for example, your gut produces 95% of your happy hormone. Now, just imagine if your gut is not doing well, if it's not able to absorb food well, automatically, or say studies have shown that such patients or IBS patients are not able to produce that serotonin in their gut, and due to which they automatically feel more stressed. Now, because of this stress, again, since it's a two-way communication, their stress get triggers more. So actually, it is just a trigger cycle of IBS. A lot of patients get stuck into this loop. So yes, so just diverting further from the slides and from the topic, I just want you guys to focus on the coming picture, and it's actually a stool picture. So stool gives a lot of insights about what is going inside your gut. It tells us a lot of inside story about the way you're digesting food, about the way you're feeling. So let's just have a look at Bristol's stool chart. Uh, and so the type 1 and 2, if you see, it's actually constipation stool. And if you see type 5, 6, and 7, it's a diarrheal stool. So these are most commonly seen in IBS condition. And if you're having type 3 and 4, great. That's basically your normal stool you're having. So moving further, yes. So when I talk about triggers of IBS, again, there are certain conditions, or there can be certain food groups or say medication which can trigger your IBS. Let's have a look. Now, diet is one of most important trigger factor of IBS. Why? because the diet has certain food option which can help you, which can also worsen a condition, but at the same time, it can help to heal that condition. Now, for example, as simple as having cabbage or cauliflower can trigger your IBS. Why? Because cabbage and cauliflower contains a chemical called raffinose. Now, raffinose is just a complex carb which is difficult to be digested. So that's why it's great to be, it's best advised not to be taken in IBS. Antibiotics. Yes, we all have heard we must be taking, if we say anyone who is suffering from a common cold or flu. So the role of antibiotics is to kill the bad bacteria. But a lot of times what happen when we are taking antibiotics, especially for a long course, at the same time, it kills good bacteria also. And due to which there is a lot of trouble which goes inside in our gut. And there is an imbalance of good versus bad bacteria created, due to which our gut health is compromised. And again, the IBS get triggers. Third, most important one, food poisoning. Why a lot of patients suffer, especially in a country like India, where street food is so popular, but at times hygiene standards are not being properly followed. Due to which, what happens, a lot of toxins by such harmful microorganisms are released into the food, due to which there are higher chances that people fall sick after eating street food or say any food where hygiene standards are not being followed, due to which what happened, their gut becomes more sensitive, and after getting recovered from food poisoning episode, there are higher chances that the person develop post infectious IBS. And the fourth one again here is chronic stress. Again, I explained that how the person is stuck into the loop, and these are the major four triggers of IBS, you can say. uh, Moving further, as I mentioned that again in food we have options which can trigger, but at the same time there are certain foods which can help heal down a condition. So let's have a look at few questions, and you can drop your answers in the chat box. The very first, again coming back to the apple question: is an apple safe to eat for someone with IBS? You can write your answers in the chat box. Okay. All right. Shelly says no. How about others? Okay. Okay. All right. Okay, thanks, Kaushik. Thanks, Raghu. Yes, so actually, an apple is not safe to be taken in IBS. Yes, we have heard that an apple a day keeps the doctor away, but when it comes to a condition like IBS, apples are not advisable. Why? Because your apple contains hard to digest carbohydrates, that is your fructose and sorbitol. When they reaches your large intestine, they draw more water and cause more bloating and abdominal pain, ultimately leading to more they aggravate your condition of IBS. So that's why here in IBS they are not really advisable. I hope that's clear to everyone. Moving further, we have just two more questions. Second is, which is better and safest choice in IBS? Uh, any answers, guys? Uh, the options are white polished rice, chapati, bread. Okay, Kaushik says rice. Shelly says option A. Okay, Dhananjay Deshpande say non. Okay, all right. Okay, yes, right. So the answer is your white polish, right? Absolutely, you're right. So herein, what we have to see, mostly your whole wheat flour or any product which is made out of wheat flour, it has a protein called gluten, and gluten has been known to cause inflammation, especially in condition like IBS or other gut-related condition. So it is best not to be taken. So herein, white polished rice are easy on your gut and easy to digest. So it's the best option we can go further with. But in diabetes, the things take a little toss. We have to keep in mind the portion control, and as well as we can look out for other millet options also. Moving further, the last question. Uh, Post bedtime, which of these tea relieves symptoms of IBS? Your options are black tea, pepper tea, or peppermint tea. Any answers, guys? Okay, Saurabh says option A, black tea. Okay, no idea. Arvind says A. Okay, how about others? What do you guys think? Because this can really help you relieve your symptoms and can also help to bring down those cramps or abdominal pain at night. Okay, so Varna says peppermint, Shelly also says peppermint. Okay, and the correct answer is peppermint tea. Yes. Uh, why it happens herein is because the peppermint tea contains a specific compound or say chemicals called menthol, and it helps relieve your cramps and abdominal pain. So let me just clear this one thing here. Here, peppermint tea is a type of mint. It's not peppercorns or mint. It's just a variety of mint. To clarify further, there are actually two varieties of mint found in India. One is spearmint, which is actually sweet in flavor and have like mild flavor. Whereas when I talk about peppermint tea, it has higher menthol content, due to which it has a very pungent, spicy flavor. So that's why if you're going out there in market, especially to buy mint and to relieve your condition of IBS or any gut health condition, my advice is to go for peppermint, especially because the peppermint contain almost 40% of menthol content. Yes. So when I talk about management, now what we have to keep in mind is that IBS, first of all, is not a disease. That's why there is not one single thing or simply popping a pill can help you relieve that condition entirely for your lifetime. There is a combination of approach along with medication as a parallel approach you need to keep in mind. So herein identification of your triggers becomes very, very important. So, how do Daily Bloom IBS team is helping in that? These are actually called three pillars of your IBS journey. The very first is diet management. Herein, what we do, we try and divide your diet into various four phases. We start from your gut cleanse, followed by we removing all trigger foods from your diet. It can be as simple as onion or cabbage or watermelon. All these seemingly healthy foods, which are actually triggers in IBS, are being removed. Followed by that, we have reintroduction where we try and determine safe portion sizes for you, which works well for your condition. After that, we know that this food works for you, this food does not work well for you. So, in short, you know that this is the diet which works for me, and it's a well personalized approach. It's not a blanket approach which is done for everyone, but keeping in mind each and everyone's individual tolerance is what we have to keep in mind. Second is emotional well-being. So herein we learn a lot of techniques from our psychologists and emotional wellness coaches, from mind to body relaxation techniques. And your third one is yoga asanas. Now, again, these yoga asanas are focused on your IBS symptoms, which can be now, for example, if you're suffering from, if you're having constipation, we have yoga asana for that. If you're having bloating, we have yoga asana for that. So keep these three parameters are the one through which we are trying to help people understand and manage better their IBS. And so far, 80% of our patients have seen relief in their symptoms on completion of the program. So moving further, what we have to keep in mind is that especially the diet part have been scientifically mapped and designed. My advice to you people would be do not go just out there and Google diet charts or IBS or anything related to diet related to IBS, because a lot of time what happens in an IBS, we are following an extensive restrictive diet. So if you do it without an expert guidance such as that of a dietitian, what happens is a lot of time you develop nutritional deficiencies, which can be something as bone disorders or anemia. So my advice will be please go talk to a person who can actually guide you for this. And that's it from my side. Now we are open for questions. Please let me know if there's anything you want me to answer. So Kaushik is asking, mint is okay to have. Yes, Kaushik, mint is okay to have. The best way to have mint is what I can advise. The very first is after finishing your dinner, you can have a cup of peppermint tea and just have like water, and in that you can add few mint leaves. It can be warm water, or it can be, or you can have simply some lemonade with peppermint leaves. So I think it's good to have. Okay, okay, okay. I think Ankur is. Let me just close my. Just give me a moment, guys. I'll just stop sharing my screen. Okay. All right. So, Ankur is asking, are dairy products safe in IBS? Now, Ankur, what we have to see, the dairy products contain lactose, which is again a type of carbohydrate or sugar. And usually, if in IBS, it has been seen that a lot of patients are lactose intolerant or lactose sensitive. They are not able to digest this particular lactose. So, I'll advise to avoid dairy. Otherwise, you can go ahead. I think curd and buttermilk are better tolerated by few of the IBS individuals. But again, it depends on an individual tolerance. So a lot of patients are not able to digest milk, but they're able to tolerate buttermilk. So you can experiment and see what is working for you and how you're able to have it. Okay. So Dhananjay is asking, what is peppermint tea? Dhananjay, okay. Dhananjay, so peppermint tea is actually nothing. Just take warm cup of water, take few peppermint tea leaves. Peppermint is actually just nothing but uh, mint, which is having higher menthol content and which is more pungent in taste. So you need to have like 10 to 15 or say 10 mint leaves in that cup of water. Just let it sit for 5 or 10 minutes. Crush them. Make sure you're crushing those mint leaves and then adding. Why? Because then the oil glands and then the oil content, the menthol is secreted. So make sure you're crushing those leaves and then adding in that cup of water. Let it sit there for 5 minutes and then you can have it. I hope I was able to answer your query, Dhananjay. Uh, okay, Arvind is asking, peppermint tea is helpful in bloating even though there is no abdominal pain. Yes, Arvind, it has anti-spasmodic properties, and at times bloating also has distension, which can help you relieve. Also, it has been shown that peppermint tea has anti-inflammatory properties also, so it might be helping you in that way. Okay. Richa is asking, is that okay to take soft drinks while having food? Okay. Okay. So, Richa, this is a very common practice done by 21st century human or who are prone to eating out. What we have to keep in mind, soft drinks have higher amount of dissolved carbon dioxide, and due to which what happens, it causes more of acidity in your body. So, my advice will be to you not to have any sort of drinks, especially while having food, and soft drinks are a big no. Neither with food, neither with anything else is what I can advise you. The best you can take any other drinks can be lemonade or coconut water or buttermilk or chas or lassi are the few delicious summer options I can advise you. Okay. Okay, I'm not able to see your full name. Okay. Is IBS a long-term condition or there is a permanent remedy? Okay. So as I previously also mentioned that IBS is actually a disorder. It is not a disease, meaning we do not have clear cause, and that's why it cannot be 100% cure because it's not a disease. So the chance of curing takes a toss. So herein we have to do the management. So it can be as simple. I'll just give you a quick example for diabetes. Now, if you're staying away from chocolates, your glucose level are pretty much stable. You're not going to experience that glucose shoot up, normal. But the moment you have chocolates or any sweets or say any fruits which are not advisable, your glucose shoots up. But then your glucose immediately shoots up. So that's what also happens in IBS. As long as you stay away from your triggers, your IBS is well managed. The moment you take any trigger food, for example, milk, your IBS might be triggering again. It might shoot up again. So that's why the permanent remedy here is not as such, but management is what we have to keep in mind. Okay. Shelly is asking what type of cereals are good in IBS? Can you give some options? Okay. So Shaili, one example I've given in my questions also is rice. White polished rice is what we can have. Otherwise, you can also go with brown rice, but again, we have to keep in mind the quantity. Otherwise, millets are also one such good option. But again, portion control has to be kept in mind because again, if you overdo on millets, first of all, the fiber of millet is tough to digest. So you cannot have three times a day. My advice will be to you to have one time. Divide your meals and have just one meal as millet, and the other two meals you can take it as say rice or say uh, yeah, or maybe it can be brown rice or it can be oats or it can be quinoa. Okay, I hope I was able to answer that, Shelly. And okay, what kind of fruits can we suggest for IBS? Okay, you can go with oranges, you can go with pomegranate, but again, in pomegranate anar, you have to keep in mind what portion you are taking. And yes, and pudina and coriander chutney suggested by my dietitian. Okay, that's great. You can go with that, Kaushik. No worries. Is IBS curable or it stays with you? Saurav, as I previously mentioned, IBS is not curable. It's a disorder, and we need to find our triggers and then manage it. Dhananjay, about curd and buttermilk, it will again depend on your individual tolerance. A lot of patients are not able to tolerate even curd or buttermilk because of lactose intolerance. But if you are able to tolerate them, because in curd and buttermilk, usually your lactose is pre-digested. It is already converted to lactic acid. So it's easier on your gut as well. Okay, thanks, Savirna, for that. Okay. In case of pulses, should we take washed pulses or whole pulses? And is it okay to take sodium? Okay, Shelly, in case of pulses, it's better we take the washed pulses because it can again cause us a lot of bloating. Now again for chole, rajma, lobia, they can again cause you bloating and gassiness. So my advice to you will be not to take. Okay, Arvind, in this program, we are not taking stool test as of now because it's completely, we are following a holistic approach. We are not going into any test. We are trying to we are trying to manage your condition through holistically through diet, through yoga, and emotional well-being. So that's why we are not asking for stool test here any further. And usually, the individuals who come up to us are either diagnosed or non-diagnosed who have symptoms related to IBS. So that's it from my end. And just one more minute to go, then we need to wrap up, guys. Uh, okay. And this, okay. I think that's it. I hope I was able to answer questions from. Okay, yes. All right. Okay, I think I was able to answer everyone's question. And if you want us to if you want to schedule a free session with any other nutritionist, feel free to reach out to our team. You can go on our website and look out for nutritionist session. And I hope that today's webinar was helpful for you guys and you were able to get some few insights in your journey. All right. Thank you so much, guys. Take care. Have a lovely weekend ahead.